Hello, everyone, and welcome to our Emble IUD presentation. All of us are different, and it's why our generation has embraced body positivity for all. More inclusive modeling, support on social media, makeup and clothing lines for different body types and skin tones, you name it, it's improved over the last 5 years. So then why haven't we done the same for our uteruses? 1 in 20 people with female reproductive organs has an abnormally shaped uterus, and yet the US only has 3 IUD size options and no alternative shapes, as there are in other countries. This lack of options makes this inaccessible for a lot of people in the US, which can be seen in the fact that only 6.5% of people have an IUD, and the number is much higher in countries such as Norway at 27%. In addition, 10% of people in the US who do have an IUD, the device expels, either coming out of place, falling out completely, or dislodging into the abdominal cavity, which renders it useless as a form of birth control. Most are also looking to get away from hormonal birth control, given as it has negative side effects on the body and mind, such as an increased rate of depression. It's time to take the next step in healthcare and diversify our birth control options. That's why we've designed a product that accounts for different uterus shapes and sizes, so those looking for long-acting and reversible birth control have a safe, comfortable, non-hormonal option that they can trust.
With all of this in mind, we created an IUD that can be custom sized. The IUD is designed to function like an umbrella, in which there is a runner that extends the stretchers to their desired location, depending on the uterus shape and size. This runner also contains a locking mechanism to hold this desired shape. The locking mechanism is devised of round nicks along the base that the runner can click into. The umbrella shape allows for the IUD to be inserted into the body, similar to the existing IUDs. However, this one can be adjusted into the body to ensure a more secure fit and reduce the chance of embedment or expulsion. The length of the device will be 36 millimeters, and the width is adjustable, ranging from 20 to 32 millimeters. This is more accessible for women who have never been pregnant before, as their uteri tend to be smaller, with an average width of only 21.6 millimeters. This device will be similar to current copper IUDs, with a low-density polyethylene base and a copper wire wrapping around this main branch of the umbrella. We chose LDPE because it is biocompatible, has strong flexibility and elasticity properties, and is resistant to corrosion, which is important in a device that has moving parts. The copper here acts as a spermicide, preventing the sperm from fertilizing the egg, as the copper ions are released into the cervix. The amount of copper wire in this device is based both on the recommended daily intakes and the ISO standard for copper IUDs.
The device will be removed in a similar fashion to traditional copper IUDs. The umbrella-like will be retracted and the arms will fold upwards when a force of 5 newtons is placed on the strings. No force close to or above this force should be experienced either in the uterus on the device or on strings in the vaginal canal. This ensures that the removal mechanism will not accidentally be deployed.
IUDs can range from $0 to $1,300. This cost covers the initial medical exam performed by a practitioner, the visit to insert the device, and any follow-up visits as needed. Most insurances cover this cost, but in the case that they don't, it can be initially expensive. Overall, depending on how long it is used, IUDs can be less expensive than other forms of birth control, since the only additional cost after insertion is the follow-up visits as needed. For example, the pill has monthly payments that can cost up to $50 a month without insurance. In just over 2 years, this cost would exceed the overall cost of an IUD, but in a much shorter time frame. Our novel design offers many benefits to the user. With our umbrella shape, expulsions will be less common than other products on the market, and therefore non-routine follow-up visits will not be needed. The shape allows for a wider range of users, since it can be adjusted to different uterus sizes and lies comfortably in the uterus. Using copper as a spermicide rather than hormonal options is safe and reduces the risk of increased depression. Patients with our copper IUD will be able to have a birth control method that is 99% effective and will last up to 12 years with the option of removal at any time if needed or wanted.
The main competition for our Emble IUD is Paragard, which is the only FDA-approved copper IUD on the market. It has the typical T shape and measures at a size of 32 by 36 millimeters, which is larger than hormonal IUDs, often making it not suitable for women who have never been pregnant. Hormonal IUD brands such as Mirena, Kylena, Skyla, and Lileta are competition for our device as well. But like we mentioned earlier, people are looking to move away from hormonal birth control because of the adverse side effects it can cause. Outside of IUDs, other alternatives include other forms of birth control, such as the pill, NuvaRing, Nexplanon, spermicides, etc. Given the nature of our competition, the Emble IUD has the potential to alleviate many of the apprehensions surrounding current birth control methods. Since none of the current products mentioned are adjustable, our IUD provides a new option to users that will better fit their uteruses. So thank you for listening, and we'll take any questions at this time.